On to Karnataka now, which has begun a 2-week lockdown in a bid to break the huge rise in cases in the state. Bengaluru now has over 2 lakh active cases, and the health infrastructure is sometimes unable to cope with the demand for ICU beds, oxygen and medicine. My colleague Maya Sharma joins us live. Maya, if you could brief us about the new curbs and any restrictions on interstate and intrastate movement currently?
The lockdown, the 2-week lockdown in Karnataka has begun last night. There is restriction for travel within the state and between states as well, unless it's emergency. Right now, essential shops are meant to close at 10 a.m. So you can see people making last-minute purchases. And in other small shops as well, people are actually shutting down. They're shutting down and going, as 10 o'clock really is the timing for even essential shops to shut down. Some places, of course, can be open. We've got medical shops, which will be open. They are, of course, permitted to actually run. But other shops, non-essential shops, shutting down in keeping with this 10 a.m. timing. What are the other restrictions? Well, trains and planes can actually enter the state, but no buses. Buses will not be permitted to ply. People can use their train tickets and their plane tickets in order to have a pass, a movement pass. Vaccinations will be encouraged, and if you're going for testing also, you're absolutely permitted. Agricultural, manufacturing and industrial activity can continue, but garment factories will be shut. And of course, educational institutions will be closed. The bid, of course, to try and break the chain, stop the huge rise in cases. We're in a city now with us over 2 lakh active cases, so it's clear that the state government felt that something very, very urgent needed to be done. Now, why is Karnataka actually seeing this huge spike in cases? What are the reasons for the state and the city to see these absolutely massive numbers? Let's take a closer look at why this could be. The city of Bengaluru, a medical hub, and now home to around 2 lakh active cases of the coronavirus. Why did this happen?
Bangalore, being a socio-economic hub, seems to be the most likely target for the virus because we have extremely high social activity and economic activity both. So there seems to be a growing concern now with these rising numbers. As a member of the committee, as a part of this thing that we've been participating, somewhere I feel the citizens also let you down.
I feel that when there was an initial spike in the cases of COVID, the government would have been a little preemptive. When there was a short spike, they could have gone for an early lockdown and aggressive COVID curbs in the initial phases.
Bengaluru went from around 21,000 active cases at the start of April to around 2 lakh cases now, an almost tenfold increase.
There has been a sudden surge in the cases, and it has primarily been there because of the free movement of the people. Although redundant at this point in time, I think there should have been adherence to the COVID norms even after the caseload was a little down.
Ahead, the hope is that the 2-week shutdown will provide a breathing space.
Now, lockdown in my observation is a way to prepare. It is not a solution by itself. Our key aspects and focus in preparation is oxygen and manpower. I think these are the 2 core areas that we are looking at. While we have beds, either there is shortage of oxygen or there is going to be shortage of manpower, and I think the next few weeks is going to be a crucial period for us to get ready for these 2 aspects.
I believe there could be a new variant of the virus that could be seen in Bangalore. Maybe aggressive genetic sequencing of this variant could really help find new ways of overcoming this.
The responsibility of the people to observe COVID protocols and get vaccinated. The responsibility of authorities to lead by example and use these 2 weeks wisely. With Govind Murthy, Maya Sharma in Bengaluru for NDTV.